said, Gene. Jeff Merkley.
Back when I came to the Senate in 2009, we had a President Obama, and a Senate that said, hey, let's really work towards the vision of everyone in America having the opportunity to have affordable, quality health care. And in April of 2009, Frank Luntz put out a memo, and he was a strategist, and he says, whatever Democrats are doing, let's call it a government takeover. Whatever they do, we'll call it a government takeover, because we've done focus groups, and that scares people. Well, I quickly saw how scared people were as I started doing the town halls following Senator Wyden's example of a town hall in every county in Oregon every year. And people were terrified. They were showing up in extraordinary numbers and so angry. Why would you take over our health care? And I'd say, you know, and they'd say, why don't you listen to us? I'd say, okay, I'll listen to everybody in the room. And I'd say, I'll recite some of the provisions of Obamacare, and you can tell me step forward, step backwards. Cover pre-existing condition, 80% of the room, rural Oregon, angry people. Oh no, that piece we like. And your children being on your policy to age 26. Oh, 80% of the room. Oh yeah, we like that. And I went through different provisions, but two of the provisions that were engaged here was one, tax credits to help middle-class families buy health care. Oh yeah, universally, we really like that. And expanding Medicaid in order to cover the gap between our less affluent families that currently have Medicaid and middle-class families who will be able to buy health care in exchange. No, that's great. And a side benefit, a lot more revenue flowing into our rural clinics and our rural hospitals. So 2009, a blue trifecta says, let's fill in the gaps and make sure that everyone in America has opportunity to have health insurance so that when they need medical care, they'll be able to get it. Now let's turn the clock from 2009 to 2025. And we have a red trifecta. And what is their message? Let's tear down health care so millions of American families will suffer. 2009 blue message, let's fill in the gaps so everyone has health care when they need it. 2025 Republican message, let's tear it down and let families suffer. That's the extraordinary distinction. And that's why we are here at this moment to say we need to reverse what my colleague just called Trump care, what was done in the big, ugly betrayal of a bill where it tore down the ability to provide those premium tax credits under Obamacare, when it proceeded to put in danger Medicaid across the country by changing how states could provide matching funds to keep Medicaid going. What does this mean when a family loses health care? It means, well, they often have to choose between paying their rent or buying their groceries or paying their health insurance, going broke. They have a medical condition and they don't have health insurance, now they're in big, big trouble. You know, we're the only developed country in the world in which people routinely declare bankruptcy because of medical conditions, even with what we have succeeded in doing since 2009. But this big, ugly betrayal of a bill took us the opposite direction. What else happens? Rural health care suffers. We saw last year in Baker City, Oregon, a maternity care ward shut down. People are going to have to drive 70 miles, and in winter that highway is often shut down in order to deliver a baby. How scary is that? Pretty damn scary. And that was with expanded Medicaid. What happens if that's not there? What happens when you lose Medicaid coverage for 15 million Americans? Well, I can tell you what the experts are saying. They're saying 300 rural hospitals and clinics will be at risk of either shutting down or greatly curtailing their resources. That's the the Shep's report, a real authority on rural health care. So this is wrong. It does so much damage to the quality of life of so many people. I hate the fact that we will hear stories about people who didn't go when they had a condition, and 6 months later, that small lump turned into ravaging breast cancer, or so many other possibilities when you don't get care early and effectively. So that's why we're here to say, hell no. hell no to the big, ugly betrayal of Americans. Let's restore the cuts that were torn down, that were established, the savaging American health care in that bill, and let's apply those enhanced premiums to keep health care affordable for middle-class Americans. The numbers for Oregon, for people buying health care on the exchange, it will be a 68% increase in their premium, about $1,300 a year on average. That's a deal breaker for many families. Let's not let that deal breaker happen. Thank you.